Joining me now from the Grand Traverse Health Department is Wendy Trout. Wendy, I guess first of all, what's the latest information about this fungal meningitis outbreak?
Well, I can give you the latest numbers. Nationwide, we have 137 cases and 12 deaths, and in Michigan, we're up to 29 cases and 3 deaths. But happy to report no cases in northern Michigan or Grand Traverse County at this time.
Okay, so no cases in northern Michigan. I guess, first of all, what is the health department here locally doing? Because there was one clinic that did receive some of these tainted injections.
Yeah, we did have one local clinic, which was one of the 4 in Michigan, that unfortunately received some of the contaminated product. And we have been assisting them with contacting any patient who was at risk for receiving that product, and also partnering with Munson Medical Center as they're getting maybe people who have received the product concerned or maybe experiencing some symptoms. So we're working with them on a hotline.
And the cases, as you told us at the beginning, they continue to rise. Do we expect them to continue to rise even more in the next few weeks?
Yeah, as outbreaks typically progress, the number will probably continue to increase. Hopefully, since the product was pulled, that number will start to dwindle at some point, and the outbreak would be over. But it's really important for people to know that this is not your typical meningitis, so it's not transmissible person to person.
Okay, so you can't get it from person to person, but what are the symptoms? What should people who may have received the injection, what should they look for?
After the injection, they should be monitoring themselves for as long as 8 weeks for fever, headache, or worsening headache, numbness, weakness, nausea, even maybe some sensitivity to light, or other kind of neuromuscular symptoms that they may not have experienced before.
So besides it not being transmittable person to person, what are the differences between fungal meningitis and then the bacterial meningitis that we hear about often?
The symptoms are similar, but I think one of the key differences is it's a more gradual and milder onset of symptoms. So, some of the symptoms people could think, oh, it's just the flu or something, and it very well could be. But if they did receive an injection and they are experiencing symptoms, then they probably should call their medical provider, or seek help.
Okay. And once again, there is a hotline. Do you have that hotline number with you at all? Just so in case people want to call, if they start seeing some of these symptoms, they can call?
Sure. If they're one of the people that received a shot and are wanting to talk to someone about symptoms, the number is 231-935-2199.
Okay, great. Is there anything else that you think is important for people to know as we deal with this serious situation nationwide?
Well, I think it's important for them to know that neuromuscular and rehab associates in northern Michigan and Munson and Grand Traverse County Health Department are really working together, just very concerned about patient safety and trying to make sure that anybody at risk is identified and then they're getting the help they need. So we have good community partners here.
Great. Well, thank you very much. And we, of course, will put all this information on our website, UpNorthLive.com.